All right, thank you this morning for coming again to this great conference and this great center that UNC's prepared for us. And I get the honor of introducing my dear colleague, Dr. Joan Mazur, who is now, as of last year, emeritus status. But, well, I have to say, though, I don't know what the hell that means because she works harder than most of my other colleagues. So I don't know what retirement really bought her. Every once in a while in your life, you get really lucky that people come into it that make you better than you really are. And that's the truth with Joan. I've known her a number of years. She's a true Renaissance lady who's done a ton of things. I mean, she started out in social work was first.
Yeah,
And then
teaching.
Teaching was first. She was an English teacher, which comes in really handy in Kentucky for us and the way we write in Kentucky, believe me. So she gets a lot of credit for the grants and papers we publish and the grants we won for her editing skills. She did work as a social worker for a number of years and then got her doctorate at Cornell. No easy task, Cornell being one of our top institutions. But she's been with us now since the 90s at least. She predates me by several years, helped the Ag Center in its infancy, and then helped us with the ERC. And I was delighted whenever Dr. Menino stepped down as Ag Center director and I came into that role that she was willing to be the deputy. She really does do a tremendous amount of great things for us. Gives us guidance, direction, is also my conscience from time to time, which I need. So I'm grateful that I was able to introduce her this morning to talk about an amazing amount of work we've been doing the past 2 or 3 years now on farmer mental health. Thanks.
Thanks, Wayne. It's always a little bit of a crapshoot when Wayne introduces you, but you did a great job. Thank you, sir. Today I want to talk about our current farmer mental health and suicide prevention initiative that's been developing over the last couple of years, starting in 2018. But I want to talk about developing and implementing this pilot agricultural community prevention program for farmers and farm families. Today I want to focus on conceptualizing the development of the programming. I didn't have the 3 Ps. I wish I'd had those. That was concise. I want to describe the underlying theoretical anchors to the design of the program and the research to practice applications through a community of practice lens. I want to discuss the preliminary program research on effectiveness and also some methodological work that we did up front. You know, you want to start out with whatever measure you start out with, but then right from jump, you ought to be making sure you're doing some psychometrics and working to get the best possible data that you can. And then I want to present program results thus far and kind of a future direction. There were many partners that we brought together for this project, and these were from the various regional universities in Kentucky. Kentucky was really the test bed that we used because it just turned out there was a confluence, an amazing confluence of funding and support in our state. And so I think what we've done for the last couple of years is really going to be a good model, you know, to kind of push out into our catchment area in the Southeast. But these were regional universities, University of Louisville, Murray State, ag educators, folks from the Department of Behavioral Health and Developmental and Intellectual Disabilities, the Department of Ag, first responders, just a wide array of community embedded folks. Our AFF division at NIOSH focuses on the top 3 most dangerous occupations with the highest rates of work-related injuries and fatalities. Now to these exposures to physical risk, we can add risks to emotional health and well-being and mental health. And this really dovetails with what Dr. Tamer was saying about the total worker mental health. We all know the relationship between these, but I think, a specific naming and focusing on things is really important. Key contributing factors for farmers include financial losses, chronic illness or pain, a sense of work-life imbalance, and/or physical and social barriers to mental health access, especially in rural areas. ag occupations are vulnerable to a wide array of factors completely out of our control. I have a 70-acre farm. There's weather, there's crop damage, there's all, financial issues, commodity markets, policy changes. Believe me, farmers are a huge voting political group. Falling market prices and labor shortages. In 2808, Bob McKnight and Steve Browning at our center looked at the epidemiology of farmer suicides in these 3 southeastern states there, and they found that there had been 590 deaths related to suicide in the states of Kentucky, your North Carolina, and South Carolina. There have really still been difficulties, though, in a research-based estimates of farmer suicide. And several years ago, 2 years ago, you may remember the big kind of dust-up that CDC put out, a big story about these skyrocketing farmer suicide rates, and unfortunately it was picked up widely by all kinds of media, but the sampling had really been problematic. They conflated farmers, farm owners, and farm hands all into one sample, and they had to retract those findings. And nobody picked that part of the story up, which might be good, but I just want to say that to be honest and fair about our lack of knowledge about gathering these kind of data, and it figures into some of the things that we are doing in our program right now. We do have, excuse me, we do have data on rural suicide that we've drawn upon to extrapolate the issues to the farming community. Farming communities, any community that has a suicide, there's data from Dr. Cyril at the University of Kentucky, a suicidologist, that says for every suicide, 135 individuals are affected along a spectrum of exposure to long-term bereavement. That's a lot of people. Willisburg, where I live, has 300 people in it. So a suicide could affect literally a third of that population. And in point of fact, that happens even we have a tractor rollover or something like that for bereavement. Bereavement of suicide loss increases an individual's risk for depression, admission to psychiatric care, and suicide death, and community mental health, community-based mental health, as well as suicide prevention programs, have been cited by SAMHSA and other groups as key to addressing worldwide suicide rates and are essential to addressing morbidity and mortality in the ag sector. Communities in particular can implement specific suicide prevention strategies that are relevant to their context and their cultures. Governor Fletcher was really making this point about relationships and everything's local, and we'll see that playing out in our work. When programs involve the creation of community networks, then there is the potential to provide social support to those in crisis, but more importantly, to fight stigma. Karen was talking about stigma yesterday, and mental health has a huge issue with this. We've talked with even in our trainings, Carolyn Oldham, my colleague, my very good colleague, we were talking about, she was out at Extension doing a QPR training, and the Extension agent there, who's really a fabulous partner, was going, we don't talk about mental illness or mental disease or, these stigmas, we can talk about emotional well-being, we can talk about stress, but we can't talk about mental health. And that continues to be a big issue. Our sort of theoretical frame on a psychological theory of suicide is Joiner's interpersonal psychological theory of suicidal behavior. It's empirically supported suicide risk factors of thwarted belongingness and perceived burdensomeness that are key community factors, and we'll see how that plays in now. We've been talking about belonging, and again, Governor Fletcher was talking about that as well for working with his substance abuse. That was the social work I was in, by the way. I ran a 4-county mental health Joiner 30-day treatment center, 10-day non-medical detox. That was an interesting situation. third largest drug program in upstate New York, near Ithaca, 60-bed residential, I don't know, let's see, maybe 100 outpatient slots in a small family clinic in a rural area where my charge is. We want to talk about the problem and access to help in rural areas. It's not just a problem of social stigma, and how do we talk about these, and how do we develop and engage communities in working on these problems. There are physical and social barriers that impede mental health seeking behaviors in rural areas. And if you've lived in a rural area as long as I have, you know, there are two things that don't change: access to health care and the damn broadband that everybody promises till they get elected, and then we do better with a cup and a string. Rural and partially rural areas where most farms are located, obviously, although of course there's urban agriculture. I got a lot of emails one time on that. Rural areas contain 68% of the nation's professional health shortage areas and 66% of the country's mental health professional shortage areas. So this just persists. We just don't have services. And we have sparsity in geographical distance. 2 in 5 farmers, though, 46% in a Farm Bureau study, say it's difficult to access a therapist, or counselor in their local community. It's not that we don't know that there's an issue. Some social barriers include conceptions among farmers, but among rural residents generally, conceptions of self-sufficiency, traditional perceptions of masculinity, real macho situations. Mental health stigma is found in agricultural communities, as they are in all rural communities, and I would just extrapolate to most communities, period. But it's quite difficult to kind of get at and even talk about in rural areas. The farming community is not deaf to these concerns. They're aware. 91% of rural adults report that mental health is important to them and their family, and 75% say it is important to reduce stigma about mental health in the agricultural community. They know how difficult it is to talk about it, which is kind of an interesting way to start that conversation, by the way. Thus, psychological distress and perceived barriers to mental health promotion are experienced at the community level. I want to talk a little bit on this section about addressing the problem, but anybody who's heard me talk about this at all, my starting point is the Farm Bill, the Federal Farm Bill of 2018. Every 5 years, Congress enacts a Farm Bill. And in the 2018 bill, for the first time ever, there were monies and programmings allotted to substance abuse counseling and mental health services. This was huge. Again, hearkening back to Governor Fletcher's talk, policy is huge. And please don't underestimate being up to speed on the policies that directly affect you or your programs or your constituents. Because when we do our Hill visits, Wayne alluded to it, somebody yesterday, we go and we inform our legislators. Since 2018, even these last 2 Zoom years, when we are talking to our Kentucky delegation, we thank them right up front. Thank you for that Farm Bill. 2023, the Farm Bill comes up again. Thank you. Please keep that in there. Don't let that get hacked in the rack and stack. So, make sure that you know legislation that your contingent has sponsored or that directly affects. If something's in the Farm Bill, I can tell you everybody talks about it because it determines, price supports, it determines all kinds of stuff that directly affects day-to-day work on a farm. And the 2018 Farm Bill had multiple things in it. USDA is now managing the Farmer Rancher Stress Assistance Network was the 2018 Farm Bill's program that is now administered through USDA. And it essentially has 2 big programs that we are engaged with. There were 4 regional, Northeast, South, and West, consortia funding for mental health services among those 4 areas and arenas. And then there was a specialized program that was targeted only to state departments of agriculture. I mean, there were 50 grant slots, one to each state. All you had to do was submit it. And there were some states that didn't submit, which is kind of weird. There were also, I have a little citation there. If you look back on these bills sometimes, there's a really great side-by-side comparison of the previous Farm Bill and the current one. But for example, 20% of the distance learning and telemedicine program funds that provide substance abuse disorder treatment were moved from telemedicine distance learning into, those monies went into this Farm Bill programming. So here we have an opportunity for real funding for telehealth, telemedicine, actual monies that can be included in your grants or your programs that are specifically mandated through the USDA monies. So we knew we had to do something. In 2018, the AgriSafe Network was one of the first recipients of the pilot monies that came out of the FRASAN grant, Farm and Rancher Stress Assistance Network. And they had contacted Wayne and said, would the Southeast Center like to have a sub-award to develop some mental health, farmer mental health, community-based programming. So my presentation today really focuses on my thinking up front while I was writing that small grant and how we came to the kind of position we're in. I think with so many young researchers, and it's great to meet you all, I'm glad to be leaving in good hands, I can say. But some of the focus questions up front for me were, what does community actually mean? We want community-based programs. How do communities evolve? We're not, obviously, with stigma and sparsity of resources, the existing community structures have not been effective or just simply, for whatever reason, don't work to support farmers and farm families in addressing mental health problems. How can we change practice? Stigma is a practice. It's something people do, and it's something that's experienced at work and in community settings. The goals of a community-based program that, in my mind, I found my notes, it was kind of interesting, to engage a farming community that acknowledges the farmer mental health suicide problems, prepare them with the knowledge and skill of best practice, set the stage for ongoing evolution of tools and resources, and address the issues of sparsity of rural mental health services and supporting access. So my actual starting point, my master's at Cornell was in educational philosophy. This is a good thing for most people, but you're going to have to suffer through a little bit of my conceptual wanderings. So I really am interested in meaning and in defining. That's my English teacher, too. You can do a lot of reading just looking up theories of practice. There's a lot of stuff out there. We're always talking about changing practice, best practice and stuff. But what do we actually mean by practices, and how are they applied in various work settings? There's just a plethora of literature and interesting work out there. Practice theories articulated in diverse fields, many of which actually dovetail with a lot of our cores in the ERC. There's nursing theory. There's a theory of planned behavior that a lot of you probably use or are familiar with in medicine and social work and so forth. That's one of the ones that I think has actually sort of risen to more widespread use. Social work, each one of these I could have put 5 sample theories, but systems theory is huge in social work and in many organization of work and so forth. But in looking at organization of work, I really settled on this community of practice. I was familiar with this. I had done some work on a community of practice for technology implementation in schools at Cornell. And Lev and Wenger were 2 anthropologists in the mid-'80s that were looking at the organization of work and how experience and work practices are transmitted. And they really went back to guilds and apprenticeship models and so forth. So I thought, well, I'm going to go back and look at Lev and Wenger. And I really sort of reminded myself of how interesting that theory was and how applicable, in my view, it was to be able to translate into practice. There are 2 types. There are many types of theories, but for the purpose of this talk, theories are either descriptive or predictive. And so for this initial work, my thinking was worried about descriptive theories. What are we talking about here? How do they operate? And therefore, sort of application of case study. If you want to really read something that's way too dense but really interesting, Bourdieu's theories of practice have been. He really set the stage to say communities are social actors in cultural dispositions and structured by previous events and practice. And Lave and Wenger also defined practice as a set of common approaches and shared standards that create a basis for action. Very important, communication and problem solving. Community of practice is the term that they used. Communities of practice are systems that have three essential elements: joint enterprise, mutual engagement, and shared repertoire. Joint enterprise defines what we need to do together, and I was able to articulate them in the grant that I was writing. Mutual engagement is bringing together existing communities and agencies that are already somewhat engaged in mental health work or social work or farm work, ag credit, farm bureaus, commodity boards, and then bring them together for the mutual engagement in this problem. And we were engaging groups that really care about farming and farm communities and their neighbors. And shared repertoire and meaning, and we settled on QPR as and other kinds of training as a starting point for tools and resources. And beginning with that small $48,000 grant, some money from our continuing ed program, we were able to train 17 trainers who trained in a year 415 community members, equipment dealers, commodity board folks, ministers, people who really deal with farmers every single day and who hear these conversations. It's the equipment dealer who hears that Mazers are selling off all their equipment before harvest. That's not a good sign. And you want to be able to question, persuade, and help get that person. Really don't let that go and say, oh, well, I guess they just need the money. That's a very bad signal that things are not going well. The Kentucky legislature, we have a champion, and Representative Brandon Reed has funded 2 legislative appropriations that went to the Department of Behavioral Health, and we have a subcontract with them for $500,000 each. And it looks like in the next 2 years, we're going to get appropriation 3 and 4 based on productivity. People fund you if you do what you say you're going to do. And 40 more QPR trainers, and with that, 17, those trainers, thanks to Dr. Oldham here, who's really QPR trainer extraordinaire. Over 1,000 community members in the state of Kentucky have now been trained in QPR. And we modified the QPR. The training itself is standard, and to get your certificate, you have to do it. But we bookended it with agricultural communities QPR so that we could talk about the stressors and so forth and make it culturally relevant to ag communities. Communities of practice have stages. I hope you can read this. It's kind of, but potential, coalescing, maturing, and stewardship. And we're kind of, the current status of development, I think I'd move that more over to maturing. But some examples of potential were the development of our partnerships, the coalescing around training, and now stewardship. This is not correct. It's McCracken County, not Marshall County, extension agent. Samantha Anderson contacted Dr. Oldham about, a month ago and said, we need help here. Marshall County was the only extension offices in an 11-county area hit by that tornado back in December of 2021. Those of you that are working in natural disaster, and I'm sure you're familiar with EF3, EF4, leveled communities. Mayfield is just about gone. Their feed mill is gone. Their second largest poultry hatchery in our state is gone. The schools are gone. UK's research and education ag center in Princeton, Kentucky is gone. And so those 11 extension offices are all coming to McCracken's, which was just spared. It wasn't hit. The county was not hit. And Samantha wants help with mental health. So again, responsiveness, creating joint enterprise with us, but at the stage really of stewardship, where community starts taking charge of its own stuff. I want to quickly zoom through this, if you can bear with me for a minute, because any research project, any programming that you engage in must include evaluation and research right from the beginning. Don't wait to see how things go, because by the time you are into something, it's very difficult if you haven't done your case study work and your observations, as well as tried to figure out at least some initial measures of quality and effectiveness. Oops, did I miss one? So we do an evaluation on the trainings itself, for example, the QPR training. We have, our outcome really is a willingness to intervene and have these important conversations. So how great is it that we found a measure that's called the willingness to intervene? I mean, sometimes everything just kind of goes your way in research. And so the QPR trainers who were known community members and conducted the QPR trainers emailed their constituents and said, Oldham or Mays are going to be contacting you. We need to be doing research. This also funds things, but we need to do effectiveness research. And so that was our entree into that. We wanted to know if participation increased their willingness to intervene. Were there differences among, say, farmers versus non-farmers in that community? And how good a measure is the willingness to intervene? Obviously, classic classic test theory had been applied to the regular psychometrics for example, reliability. But we were interested in a deeper dive using a Rasch analysis. Talk more about that. So, not now. 415 of the initial trainees, 143 agreed to participate and completed the pre-training, and of course there was the expected attrition. 62 did the post for the willingness to intervene, and there were 38 complete pre-post respondents that we did the initial analysis on. 53% of the participants were currently living on farms, and 50 were currently working or had worked on farms. That live-work variable is really important for the farm community. We isolated that, Henry Cole and myself, several years ago. We used Kirkpatrick's model. Someone else was talking about that earlier. We also evaluated the psychometric properties of the questionnaire to kind of examine current threats to validity. And Carolyn and I have submitted, as she's our first author on this, to the Journal of Agricultural Safety and Health. So we found utility and impact, and a person who was trained, their willingness to intervene actually doubled between pre and post training survey. However, those employed within agriculture were less likely than those in other industries to be comfortable with knowledge and suicide prevention, and there were gender differences. Not surprisingly, women were more comfortable than men, but that really suggests something about our trainings. We have to talk about those, because of course the majority of our trainees are men. And to reduce the threats to internal validity, there were some items on the Rasch analysis that indicate we have to make some modifications to our measure. Stuff going forward, lots going on. The McCracken County telehealth, continued funding, what to do about growth in the community of practice. Carolyn and I experienced an interesting thing. Once, we train people in QPR, they commit to 2 or 3 trainings, they do their trainings, and then what? Are they out there all by themselves? Should we be communicating with them? Should we control it at all? Obviously, if we want the community of practice stages to evolve, we want people to have the kind of agency and ownership that Samantha Anderson had in her extension office. We're developing a peer-to-peer mobile app. That's my baby. I love that idea. I wonder how it'll go. Continuing to build on joint enterprise with a mental health navigator network in 9 targeted counties. Thank you. I'm sorry I'm running over, but I really did want to kind of give you the feel for how we conceptualize the program and then implement it and then keep doing our formative iterative design. Thank you. Thanks, Emily. I can take one question.
The question I do have is, you were talking about these QPR trainings and them getting trained up. You might have touched on it a little. I might not have recalled, but have you any data or some sort of research on how much these individuals who are trained are actually utilizing this service or utilizing the things that they've learned in this training in their workplace?
Yeah, we're just starting that. So, if you go to the website, we did make a video. It's a little long, but about the trainers' experiences and how that contributes to their different constituents and community and so forth. So we have some of that anecdotal data, testimonial kind of data. We're going to be interviewing. We're doing post follow-up at 6 months on the WIS data. And then we're going to be, we asked people if they're willing to be interviewed. And we do know that there have already been a couple people who've reported to us that they've had opportunities to use the QPR, the trainees, not the trainers. The trainers themselves, I've heard from several of them, the first responder group in particular, that have been able to employ this. But right now, that's interview data, that's sort of case data. But one thing, big outcome for us, what we've learned is question, persuade, refer. Refer to who? Yeah. So in the McCracken County thing, the extension office is going to be the point of contact for people to come in, because they're already coming in asking for help. So Carolyn was just down there last week we're having a room given to this project. There's a noise machine, there's going to be a laptop, and Eastern Kentucky University is going to have telehealth services, telepsychology services, train the extension agent offices in self-care and trauma-informed care so that they can manage this project. But this would be huge to have telehealth services in extension offices for ag communities. So we know, and Samantha knows us because she's a QPR trainer. So, it all kind of fits together. Not answering clearly, but thank you. Thank you for your time.
You've answered really well. Thank you.
Okay.
Well, the next speaker is me, so I'll get started. If you don't know me, I'm John Staley, Deputy Director of the North Carolina ERC, and I co-direct the outreach core of the new Carolina Center for Total Worker Health and Well-Being. And I just want to talk a little bit today about our work with small businesses and a little bit about an offshoot of that work with a project we're doing now. But I started with a couple of just quick stories, context. One, I was in a small store and was checking out, and this was maybe April of 2020, and the young lady that checked me out had a mask on but didn't have it on correctly, and I was like, hey, I can help you. I actually work in this field. And then she started crying. I was like, oh, crap. I'm sorry. I'm so sorry. She's like, no, I appreciate it. I'm just so scared. I don't know what this virus thing is about. I've got a sick mother at home, but I have to work, support my children. And she just kind of opened up right there at the register. It's like, I'm really scared about this. So, oh gosh, I forgot the other story I was going to tell. But with that, she's like, they told us, wear some masks here while you're on the job. So some people had, the gaiters, some had, I think, N95s on. It was a mix. Another little short thing. Lena, our director, and I, we were working with transportation here in the state to help guide them with infectious disease control, ventilation issues on buses and vehicles. And we were going over some things, and their folks just said, just tell us what to tell them. We're going to tell them do it. Just do it. And I was like, the Nike slogan doesn't work in the real business world of just tell somebody to do something without giving them the context, especially something that revolves around the panic of, again, 2020 with COVID. So I think it's relevant when we think about contextually about working with, whether it's small businesses, medium, large, whatever, that engaging the workers in the process from the get-go, not only management, but frontline workers, is really important. So I just want you to recall, give you a little bit of, if you recall, we think about the U.S. response to COVID-19, the issues that we've seen, right? Out of the way. So obviously, communication. I've been working in preparedness and response for a while. We know that's always the big issue in any event that happens. So we saw things like the concerns with, I don't know if you can see the picture, the toilet paper rush of 2020, the great rush there. Issues with social and physical distancing. It's like, well, do I do 3? Do I do 6, 9? Wait a minute, why should I even have to distance? And what's physical? Wait a minute, physical? Social? Well, I don't want to be socially distant from my coworkers. Strained healthcare workforce, we think about as an underserved population. And overall, the chronic impact, both physically and mentally. And a few of the other issues, obviously, taking you back to that fun time, if you were feeling much better about COVID, bringing you back to that great time with issues of testing. How do you get tested? Where do you get tested? Which tests are accurate? Is it PCR? The confusion around that, and then working it towards getting tested out of your vehicle. The shortage of equipment. Early on, our center, I remember here at UNC, may have done this at others. They said, if any of the business units here at UNC have extra PPE, please bring it to the wellness centers at UNC. We brought all our respiratory equipment over, all of our N95s. They were like, there's a shortage in the hospitals, which initially I was a little distraught of, I expected more out of being prepared from a healthcare and a public health standpoint, and probably some of you were as well. But it happened. Shortages, respirators, intubation supplies, et cetera. Vaccine distribution. I always said if, maybe you let Amazon or Chick-fil-A do the vaccine distribution, it would have been done quick, right? And global cooperation, or lack thereof, particularly on the part of the United States. And if you remember, federal funding, just briefly, there are a lot of funding initiatives, if you can't see this, and the little pictures come from the Small Business Administration, but we started right off with an $8 billion appropriations bill that got into business response and international response. The Families First Corona Response Act, that essentially was there for a while to help small businesses, or businesses under 500 employees, that if you were going to let them have time off, if they were sick or they needed to care for a sick loved one or a child, it would cover the cost of paying them. The biggie, the CARES Act, the $2.08 trillion. That's where some of our funding came for our Prosper work. So we've already looked at what total worker health is. And, when I teach this in class, students, particularly the undergraduates, groan. But I'm like, whether you like it or not, I like it. I like my job. I'm kind of a nerd for this stuff. But you're going to spend most of your life, if you are blessed with a job, you're going to be there in the workforce. So hopefully you do something you like. So the workplace is an important social determinant of health. And that really gets at it with total worker health. And moving from the old perspective of do no harm in the workplace, you protect the workers, the old occupational safety and health, to, hey, now we have an opportunity to improve their health. So when we think about these approaches, the CARES Act funding, each state receives so much money from that $2 trillion-ish money, and the money in North Carolina that came through the legislature went to the North Carolina Policy Collaboratory that then disseminated monies a variety of ways, but to the universities. And UNC got a variety of funds for several projects, including ours. which was the Carolina Prosper, so promoting safe practices for employees' return. So we essentially wanted to do two things. Sorry, stay in front of the mic. About, what were the safety and health needs of North Carolina businesses in light of the pandemic? There was so much confusion, right, early on. And not only from the federal level, but from the states and governors, and then was the local in charge, or can they have their own requirements of law or local ordinances? A lot of confusion, right? So what was the effect of that? And then what would be the feasibility of doing tailored total worker health approaches to help specific businesses? So we went in through this to help. We tried to identify businesses within a 10-county region within our surrounding Orange County, which is where you are now, Chapel Hill's in Orange County. Orange County, Chapel Hill, for the most part. So phase one, we invited businesses to complete a survey to look at their occupational safety and health needs. And our team, it was a Herculean effort that I laughed yesterday, if you were here, when the woman who talked about the Kentucky, Ohio surveillance program and a study they did in about 6 months. We did about a year, maybe a year and a half study in less than 6 months, didn't we, Maya? So this was something we worked really quickly to do. And it was at a time of surveying to ask, say, hey, could we partner with you? Could we provide free technical assistance? And many businesses were very happy to do it. But I remember I saved the email to our Prosper email address, one that was Fig you, Fig your project, and Fig the governor. I'll use that as the word. So there were people that were just angry and that we were creating the problem. We wanted to help. But overwhelmingly, people were like, yeah, I want some help. So we had 2 phases. And when we did this, we had the surveys, went through, and 53 businesses requested technical assistance, and 49 of them received tailored information and reports. And then we did really walking hand in hand, going through with 4 businesses, providing in-depth technical assistance. So I know this is a little busy, but this is just a snapshot showing you, and I'm sorry, I keep doing this. I've got on my bad glasses today, and I can't quite see my screen. We did a variety of things, from conducting industrial hygiene evaluations in the workplaces, providing respiratory protection seminars, a work safely COVID series that I'll talk about here in just a moment, a variety of things that were different aspects of total worker health, including the big issue with mental health, well-being, very big, right? Is that that's the same one. So a variety of activities. There we go. So with the businesses we helped, we really have a focus, turned very much so with our ERC, and particularly the Carolina Center, I mentioned, the Total Worker Health Center, of helping address the needs of underserved workers. And go back to spring of 2020, when we were going essential workers, right? And it was like right off the bat, oh, well, healthcare workers, sure, physicians, nurses, first responders, and everybody, remember clapping out the windows for the doctors, and really great stuff. And I work on a physician study and a nurse study, and they're really burned out, by the way. Their empathy levels are all-time low. But anyway, but then we started going, oh, wait a minute. Should we be thinking essential activities or workers? Well, who could that be? Well, construction, continuing infrastructure, the people who produce toilet paper, that's probably essential, at least from what we saw, right? Having enough food, so we think about that. And then you can build on that, pharmaceuticals, et cetera, et cetera. So In our work, we want to help 4 businesses that have been underserved. So we worked with warehouse and distribution, one company, one that was woman-owned office business, a minority-owned business that did transportation, and then another woman-owned that was a retirement community. But so 3 of these were classified as essential. And honestly, I would have classified the retirement community as essential because one of the big things they did was transport senior citizens to a variety of health appointments, to get groceries, et cetera. But we come back to the underserved and the little vignette. I think about like the CARES Act funding. In particular, the minority business, I remember them early on when we talked to them, and the owner said, or I asked somewhat naively, I was like, well, how did that CARES Act funding help you? That kind of helped you get some stuff? And she laughed, and she's like, a lot of that funding that's funneled down, that has gone through, went to big chains, big restaurants, big businesses. We purchased every bit of equipment ourselves. And we had to vary our work such that they were doing transportation of COVID patients. And they were learning on the fly how to protect themselves from COVID. And again, think evolving and going, how's this spread? Is it droplets? Is it, aerosol? What? So working with the 4 businesses. And we also did, this is a variety of activities. Let me jump past that in general at the center. We saw some really interesting information that a few of the quotes on the approach that we wanted to bring up. And Emily did a great job of pulling up some of these useful quotes. I think if you care about equity at all, and I certainly do, I think that looking at people's total health and well-being is the best way to acknowledge the things that might pose equity concerns and help to keep the lives and careers of the workers who may be most vulnerable on track. You think about it, so simple, but if you are a business employer, you're the leader, supervisor, if you show you care, how much difference does that make versus we'll just tell the bus people to do it. You're going to wear this, you're going to do this. There's not much buy-in with the latter versus the former. People expect it now more than they used to. Employers understand that employees expect employers to think that way. And our younger employees are looking for us to attend to their whole being. We know that, and I know there's young folks in here, students, that you expect more, and I don't have a problem with that. I know some of you have gotten that, you're the entitled generation and millennials or what have you. I'm not even sure what you call it anymore, but I don't think that's unreasonable from a public health perspective. Some challenges, though, where do you draw the line? We're not therapists, of course. We need clear boundaries for what we can and can't do, and I would add to that, say, and the resources when we're going to engage, because we know, too, that if any of you do a research study, I'm looking at young folks, businesses and places do like to be engaged in work and research to improve whatever their work environment's like, but don't go in and be the ones that collect data, be like, we're going to help you and work on sustainability. You collect your research data, whoop, I'm going to get out of here and go write my paper. And just leave them going, what was the value added? That's important. So a few of the challenges there. So is it feasible? Yes. Yes. So what I want to jump, I'm just going to fast forward here with the time. How much time have I got? Oh, okay, cool. Good deal. I was talking too fast. And I cannot even see my own, and that's actually a figure I published in a paper. That's pretty bad. So from our Carolina Prosper work with the small businesses, one that evolved from that was a business that trains women and minorities in the construction trades. And a local business does some fantastic work, and they were like, can you help us? And so it led to some work that also with this paper that we started looking at what were the challenges with the construction industry. So before COVID, it's the darker blue, workforce issues, attrition like everywhere. People are aging out, Gen Xers, gig economy workers that, the first thing I was like, gig, what gig, like a music gig? I didn't know what that was. But gig workers that may be very transient, in and out, doing small contracts, things like that, that were some of the things that were already existing. But then in the gray, we really saw these exacerbated. So vulnerable employees, which we know any disaster event, who are the people that are most impacted? It's always the vulnerable. I teach 9/11, 2001. The World Trade Center buildings started going down. And there was so much focus on the two big towers, and then Tower 8 that had the Emergency Operations Center for New York City. And well, one building that was right there that was closed and shut down had elderly living on a couple floors, and no one thought to check on them for over a week. And then it was like, oh crap, has anybody checked them? The most vulnerable are always going to be hit the hardest. And there were some issues there, but that's another story. But other things like regulatory confusion, low COVID-19 literacy, and we know that the communication has not always been really good. That we're taught in public health a lot about, particularly in some of our fields, risk assessment, risk communication, but not general, I don't know what you call it, basic communication skills. So it's not the, the disassociates are giving you a problem and explain it in English or Spanish, but simple. And when it came to COVID literacy, that was a real issue. So in our study, it was still ongoing, two things, because we wanted to look at minority workers, and women in particular, that approximately 1.1 million women in the construction sector prior to the pandemic. So a pretty large number. Well, we already know from plenty of research that women are more likely to be the working poor, going to be paid less than their male counterparts, and they were already a vulnerable employee group prior to the pandemic. So we wanted to look at, what was the impact of COVID? And particularly this business that trains women in the field, the construction trades, was like, we don't really know. We'd like some help. And it would start with some work we did. Part one was, let's develop a video educational series. So we did that, guided by this total worker health approach, which, again, we saw discussed some this morning by Sarah Tamers. You've got the traditional hierarchy of controls that most of us know from occupational safety and health. And then you bring that over into the total worker health sphere. When you think about kind of the different shades of blue on the right there, where do you focus? So you eliminate non-essential workers in the workplace. So many people working at home. Substitute the hazard. Well, you can't really substitute for less virulent coronavirus, right? So we look at other things to address. And that went into the thought process for developing these videos that to date have had, several months ago it had 30,000 hits, so I'm sure it's a lot more. That we worked with, that's actually the CEO of the company, to develop the video series, one for frontline workers and then one for management, that took slightly different perspectives, but thinking holistically, including wellness. And it's even, you can look up the videos still, if it's certain types of foods you like. When you got into it, like faith, family, friends, food, other things that get at issues of well-being. Well, being researchers, we're like, what's the impact of this? And what could be the next steps? So we started doing interviews with these underserved workers, women in the construction trades, to look at various things. Over 4 domains, some questions with the interviews. So think of job context, what were barriers and facilitators to your success in the job prior to the pandemic, then during the pandemic, And then what did you think about the video series? Did that have any impact to help us in developing or thinking ahead to develop targeted training, education for again, frontline workers, but also employers? I mentioned that about the logged views. Oops. I want to show you a few quotes that we got that, and again, this is ongoing, but it's very interesting, insights, and probably some of this won't surprise you. There's no way a woman can learn how to build a house. I've heard that before. And I've been asked if I was part of the cleaning crew. There's the good old boy mentality of construction, and then I think there's people that realize, oh, women can be electricians and plumbers. I haven't seen a lot of the middle ground, though. Bottom left, we have like a wall of toxic masculinity that we keep in our office of comments like we get every day. I think they're not always like intentioned that way, but they're received by us. It's like small microaggressions that like aren't really understood when they're committed. And then the bottom right, I can't wait for the day when it's not a big deal for women working in construction. It's just our job. Because like at least once a week, it's like, sometimes it comes from a place of admiration, but people think it's like so cool. Oh, you're a woman in the profession. Good for you. As a man, I'm married. I've been married long enough to know I wouldn't say something like that. That's fine, but I just want it to be normalized. And I leave the one sentence to the last one, that we have to be twice as good to be taken as seriously. Now think about if we start to take a total worker health approach to dealing with worker mental health and well-being, that you already have a vulnerable or marginalized group, and then you've got to work twice as hard just to feel like you're accepted. And that certainly would go for a variety of people that are racial and ethnic minorities. And I know. And I know this only as far from, you look at me, I'm a white man of a young age, that I haven't experienced many of the things that we see are going on every day in this country and are happening in small businesses. So these are the first steps we're taking from this data to think, how can we get it, this holistic approach? Think about those pillars that Sarah talked about with policy and changes such that, we all know there's plenty of problems in this country and the world. We won't get political. But there are things that we can focus on right now that have been brought up that for our field, for occupational safety and health, it's probably the first time in a long time that it's been, if not a level of salience, certainly awareness among the general public, right? And we know that can wane with social media and stuff, but still. That we have an opportunity right now to be engaging all of our stakeholders, not only in the academic sectors, which are siloed enough as we know, but with others outside, to be thinking about how can you take a targeted approach and show how important the workplace is when you're going to be spending most of your time there. And this really gets to me. I teach a public health systems course to undergraduates. And I usually do a poll everywhere question to take attendance. But I asked in one class when I was talking about public health funding, 2, cool. It's like, if you're going to cut public health programs, what would be the thing you would cut? And several students said NIH, just, in a way kind of to rob Peter to pay Paul because they get so much money and go to other programs, was what I was told, their explanation. But several said, well, that stuff with OSHA or NIOSH, yeah, you talked about that. Cut them. Occupational health and safety? Which, of course, I was like, well, okay, minus 10 points. But, there is an awareness, but we got to keep pushing that even within our own students to think about whether we're helping with small business owners, which need a lot of help still, which we will continue. But I know I'm kind of all over the place, and there's some conclusions and next steps. But we hope to, and some of these quotes came from really an issue of selection bias, that the participants were from very supportive workplaces, generally speaking. So we're expanding this out, working with NIOSH and the NORA Construction Sector Council to identify more across the country to interview. So I'll stop there for any questions. Oh, my acknowledgements. Really to thank our Prosper team, several students too, fantastic. Emily, of course, Peers for Progress that did a lot of our worker well-being, education, and then others here. So I'll just put that up there. So if you want more information about what we're doing, and 'cause like I said, I love it. Gosh, I love it. It's so cool. And let me just finish real quick with saying, I love this from the standpoint, I've done a lot of research with firefighters, and others have done that in here. I know Eric Ryan's doing some right now with firefighters, Jenna, that one time when my son, he was about 7, he's 14 now, he was like, what is it you do? What is it you do? I said, well, I do research. I do stuff to try to help firefighters because they have heart attacks on the job. I want to help them. And he sat there for a minute. He was like, so people in your field are the ones that take care of the heroes. So I leave you with that.
You brought up a really good point about collaborating with community partners and not collecting your data and walking away because then they don't understand the value of the collaboration. Could you speak a little bit about some advice on how to actually provide report back to those and still balance the need to publish papers in an academic environment?
Excuse me. Yeah, honestly, when it comes to me, any of the projects I do, I always provide some report back to them. And if at all possible, when it's something that may be leading to intervention, at least some best practices to be considering for next steps that we could potentially collaborate on. And maybe they write a letter of recommendation or support for the next project. But yeah, working with firefighters and law enforcement, that came up many times. It's like we were just didn't know what we got out of it. Go ahead.
So funny enough, I had the exact same question, but more from a student approach. I loved how you really said how like, hey, as students, it's really important that we just don't go in there, look for our data, and then like hightail it out of there. So I just wanted to know, like, based off of your recommendations and your experience in the field and working with students, like, how does that look like when it comes to like the limited experience and sometimes knowledge that students have? Like, how does that work when it comes to like, hey, like I don't have 15 years of experience where I can just give you all this like, risk assessments and controls and stuff, but I can also provide, if you just let me know the problems that you think you have, and giving me the ability to like look at your facilities, I might be able to help.
Yeah.
Sort of thing.
No, that's a great question. It's one thing with like undergraduates and internships and really don't know nearly as much as they think they know. But we think about, particularly with practicum experiences, I directed practicums at Kent State for quite a while. The employers frequently did say, we've got students coming in, they're so eager, but then they're like, what do I do? What do I do? What do I do for practicum? How do I do that? Well, they do expect a minimal level of understanding, at least as simple, I know it sounds so simple, but understanding the organization. And like if you're working with health departments, we did an academic health department model where we had health departments work with us over at the school, and then we worked in health departments, giving them baseline information as well, doing sharing, which we think about that with students. I can share some more a little bit later and by email from my experiences with that. So, I'll do that because I got some more things I can tell you.
Thank you.
Yeah.
Okay. Good morning, everyone. So here is my work, novel IR reflective coating onto textile fabrics for heat protection. then actually there is a large increase in the atmospheric temperature, and our focus is mainly on a labor cot, because outdoor workers are highly exposed to heat problems, mainly heat illness such as heat stroke, heat exhaustion, then cramps, fatigue, like that. So we have the focus on development of low-cost, efficient, and reusable heat-reflective fabric material for labor cot. That's a specific thing. So from the image itself, you can see our focus is on just kind of making a coating on top of fabric, and it should be stable enough. So that's a basic thing. So we are focusing mainly on fabrication of nanoparticles on top of fabric, means the cloth material. So from here, I think you all can hear me without the mic? Okay. Okay. Then this might be comfortable for me. So we used two main processes in this whole study. First one is plasma processing. Second one is electrospinning. So plasma is the fourth state of matter. It is highly energetic, and that's why the process, or inside the plasma chamber, we can have atoms, ions, molecules, electrons, free radicals, as well as metastable state. The one thing with the plasma is we cannot exactly predict what's going to happen within plasma chamber, since it is highly energetic, because it's highly energetic in the sense above the gaseous level. So here in this study, we have mainly two things as the precursors for plasma treatment. First one is oxygen, second one is tetraethyl orthosilicate, that is short as TEOS. TEOS mainly used for nanoparticle production, specifically silica nanoparticle production, since silica nanoparticle is having a thermal reflection property. Second one is oxygen. Oxygen in this study, we are expecting a kind of a surface etching or surface activation. So this is the second process. We used electrospinning. Electrospinning, we can have a solution on the syringe, then we can apply high potential. Yep.
We actually do need you to stand
Okay.
at the mic so we can get you recorded.
Okay, that's fine.
All right, thanks.
So electrospinning, we can use as polymer solution, then we are applying high electric potential. With that potential, the droplet at the needle tip will blast, and it will be deposited as non-woven fibers on top of whatever substrate you are using. In our case, we are using just fabric. So on top of fabric, the polymer solution is blasted because of the high potential and deposited as nanofibers, non-woven nanofibers. So that's the second technique we used in this study. And this is the entire schematics of study. Our substrate is fabric, and without any treatment, it is having a temperature, or with the IR camera, it is having a temperature effect of 35.5 degrees, while we are providing a hot plate with 40 degrees C, the exact temperature. So it is having an effective temperature of 35.5. Then after that, we performed oxygen plasma treatment. Actually, we are having a low temperature plasma treatment. That means inside the plasma chamber, the temperature will be maximum of 35 or sometimes less. So that's a touchy plasma that's not going to make any harm to the fabric. So oxygen plasma, basically that is for surface etching. That means kind of creating a surface roughness to make sure the next coating should be adhered properly. That's why I mentioned stable coating. So oxygen plasma for surface etching or surface activation. Then after oxygen plasma, we performed electrospinning on top of that using PET solution, which is incorporated with boron nitride nanoparticles. Then from the image, we can see there will be some non-woven fibers of PET. Along with that, there is nanoparticles of boron nitride implanted on top of the fabric. So the PET is acting like a binder to hold the nanoparticle on top of fabric. That we are expecting that ensures the stability of the coating that we made. Then after that, TEOS plasma, tetraethoxy orthosilicate plasma. That is to create silica nanoparticle on top of the fabric. Silica nanoparticle as well as boron nitride nanoparticle have the tendency or have the capacity to reflect heat. That's the thing we are making use of or in this project. Then there is a visual representation because on top of fabric, we have the nanoparticle implanted. Basically, first one is boron nitride, second one is silica. So those two have the thermal reflection property. With that, we can reduce the effect of heat. This is mainly focusing on labor coat. Then this is a plasma chamber that we're using, Harrick plasma system. And the volume of the volume of TEOS we are using is 0.8 ml. So we are not at all using high quantity of chemical. It is green technique. Then the duration is 8 minutes. That is optimized. We tried different time. Then the better coating is happened on 8 minutes. Then the pressure is 500 millitorr. Exactly what I'm saying is 500 to 1000 millitorr is an effective pressure to create a silane plasma. Otherwise, silica nanoparticle production is high at 500 to 1000 millitorr. Then inside the plasma is said to be uniform, but actually it is not. That's why means basically where the coils are located, there will be the high deposition of plasma. The white particles we scraped and analyzed. Then with SEM and TEM, we realized the nanoparticles are produced. That means if you are placing a fabric like what's seen in the figure and we are performing plasma treatment, that means the fabric will get coated with silica nanoparticle effectively. Because from SEM and TEM, we realize inside the plasma chamber, silica nanoparticles are forming. So after plasma treatment, we try XPS, X-ray photoelectron spectroscopy. This is basically for elemental percentage analysis on surface of a substrate. So with that, in control, it is having almost like 2.8% of silica. Then after TEOS plasma treatment, it is going up to 12.2%. That means our plasma treatment is effective. Then environment of whatever material you are implanting on the surface can be analyzed by high resolution spectroscopy. And with that high resolution, the third one, we have a significant peak of silica 2p elements. Means it's connected to the orbital thing. So silica is successfully implanted on the fabric surface, and we need to try the thermal reflection experiments later. Then XPS, from the XPS data, it is clear that our plasma treatment with TEOS is effective. Then this is the boron nitride nanoparticle, and next step is going to be boron nitride nanotube. That's why I just put it like in the red mark. So currently what we done with is boron nitride nanoparticle, and this is the solution what we used is 5% PET for electrospinning incorporated with boron nitride nanoparticle. We prepared 15 ml of solution, and it is having 50 milligrams of boron nitride. That's our solution for electrospinning. Then next step is plasma. We use 0.8 ml of TEOS for silica nanoparticle production. That's the entire thing. Then this is a transmission electron microscopic image of what we have, the boron nitride nanoparticle as well as boron nitride nanotube. The nanotube study is going to be pursued. So with the image itself, the boron nitride nanoparticle is having almost like a dimension of 50 nanometers, and boron nitride nanotube is having a diameter of around 25 nanometers. This is the SEM image of the entire substrate what we have. First one is control fabric. This is not having any coating, just the control fabric. Then second one is electrospun fibers on top of the fabric. Electrospun fibers means 5% PET solution with boron nitride nanoparticle. So from the image itself, we can see the boron nitride nanoparticles are covered and captured and firmly attached on the fabric fibers with PET. That's why I mentioned PET is acting like a binding agent. So it can ensure that the nanoparticle, boron nitride nanoparticle will be there for a long time. That's our main focus. One of the main focuses durability. So PET is acting like a kind of a binding agent. It will make sure the nanoparticle will be there. Then the second one is electrospun fibers and TEOS plasma. That means in the third row of image, third column of image, we can see the PET electrospun fibers, which is capturing the boron nitride nanoparticle, as well as there is silica nanoparticle. Then oxygen plasma have a significant role in this study because it can make the surface rough and active towards whatever coating we are preparing on top of that. So the final two set of things are, first one is oxygen plasma, then just electrospinning. At last we have oxygen plasma, then electrospinning, then TEOS plasma. So we do have two kind of nanoparticles at the end. First one is boron nitride, second is silica. Both have thermal reflection. So we are making use of both the nanoparticle, thereby we are expecting high thermal reflection. So this is the thermal imaging setup. We do have a 40 degrees C temperature controlled platform, and from there 15-inch gap is there with the fabric surface, and the platform, the thermal platform is facing towards the treated surface of fabric. Then from there 10-inch gap to the thermal camera. So this is the thermal imaging data. With the control, we noticed like while we are providing a 40 degrees C platform, the effective temperature is 35.5. Then with entire treatment at the end, with oxygen plasma, further electrospinning, further TEOS plasma, the effective temperature come down to 18.8 degrees C. So we find the effect of boron nitride nanoparticle and silica nanoparticle. These two are working well. And one already reported paper is there. They made use of the boron nitride nanoparticle with some extrusion principle to make the fiber threads for making the fabric. At that stage, they have they reduce the temperature up to 16.1, not up to, sorry. They reduce the exact temperature by 16.1. We have a reduction by 16.7 degrees. So by making use of both these nanoparticles, we find a very less effective temperature with our novel fabric surface. So future work, first one, I need to optimize some more using, if possible, using the boron nitride nanotube. That's the first thing. And analyze the stability of all the modification made on the surface, and analyze the stability in the sense, since it is for labor caught, it should be washed. So stability should be there in water. I need to check that first. Second one, since it is labor caught, sometimes they are using or they are doing some hard works with some mechanical force. It kind of getting stretched sometimes, getting teared. So at all those conditions, it should be stable. So second step is to ensure the stability with all kind of mechanical forces. Next one is analyzing the deteriorations with time. That's kind of simply aging. How the efficiency of all the coatings made is going to change with time, or how long it will be efficient enough. Then how the final thing that I'm a little bit skeptical about, because is there any way to encapsulate the entire modification with something? I don't know exactly, but I need to think about it. But other optimizations, I have a proper plan with that. But the final thing, just to make sure for long time in the sense, very long time usage, I need to think more on that, and I need to talk to my mentor about this. I'm a bit skeptical about that. Then conclusion, we prepared the fabric surface with IR reflective novel coating and with a high efficiency, and we still need to optimize a lot of stuff. Then electrospinning process is to ensure the better stickiness or the better attachment of boron nitride nanoparticle, and plasma treatment is a greener and easy way and cost-effective way too to implant silica nanoparticle. So making use of both these nanoparticle and making use of plasma and electrospinning techniques, we prepared a novel, high efficient, hop durable thermal reflective coating. Then here I need to thank Dr. Vinoy Thomas, who is my mentor, for giving me all the advices, and University of Alabama, Birmingham to give me all the facilities, and Deep South Center for giving the fund, and Southeast Regional Research Symposium for giving me such a great platform to present my work, and all my lab members and friends.
Ranjith, great presentation. How exciting. Heat is such a huge issue for so many different industries. So from a process standpoint, your thermal camera sort of measuring the output on the other side of the test fabric, that is obviously in a laboratory environment where the temperature has got to be at least 18 and a half degrees or lower, right? So that being the case, how does that translate in the work environment where the human body is hopefully 37 degrees or warmer, and you're working in an ambient environment that is substantially hotter? How do you translate that from your lab results?
Yeah, actually the work is almost like 75 to 80% now, and next is the exact analysis. We need to prepare the fabric, and we need to develop a labor coat, exact labor coat, and we need to analyze how effective it will be on the exact environment. Because this is so far in just a lab study to develop the coating and to just prove, or the proof of hypothetical approach, like we can make it and it is effective enough in the provided conditions. But in exact condition, before publishing that to or communicating to a journal, we need to analyze how it will act in the exact condition. That's still on pending. That's on the future work.
Sure. And then just for clarity, I think you said this, but the ultimate application would be the creation of fibers that are woven into fabrics. It's not a treatment of fabric, correct?
Yep.
Okay, cool. Thank you so much.
Yeah.
Hi, Ranji.
Hey,
Great presentation.
Thank you.
So what type of fabrics did you guys use so far as a substrate?
Yep. This is just a cotton fabric that it's actually my own cloth. So,
I see.
Yeah, because we don't need to actually focus on some, otherwise we can try PET electrospun sheet and we can make use of that, but we are focusing on the exact application. That's why we took the available or commercially available normal cloth. So that's why the cotton, the exact normal cotton.
It's cotton. Yes.
Yeah.
Because, I think the nature of the fabric, of the substrate will influence, as my colleague said, how the application would be. Because you could start with cotton, you can start with maybe activate carbon fibers or some other type of fabrics on which you can put this coating. So
Yeah.
I think it's very interesting, and I see a lot of future collaborations possible.
Yeah, because mostly I happen to see some of the papers, they are having they made the fiber threads in their lab itself, and I don't know how effective it will be in real application.
Yeah, sure.
Yeah, that's why we took the exact material.
Right.
Yeah.
Thank you.
No problem.
Good morning.
Morning.
Nanotechnology research is extremely exciting field at this point. And in many of the safety circles that I roam in, we're calling it the asbestos of the future.
Yeah.
And we're considering, in this case, opening up less for structural purposes, which has been a lot of the focus of research that I've been involved in, and now actually putting it on the human. And talk about construction sites or other places where wearers would be in heat environments. Is your research going to be inclusive, or you pass the torch on to somebody else? The effectiveness of the product you've made, but also the safety of the product for, as it deteriorates, that you know how much particles are actually anticipated to get out and what the environmental effect will be as we now have free roaming nanoparticles just floating in our environment.
Yeah, since it is connected with the nanoparticle usage, that's why last step I said to encapsulate this one. Because we do have a fabric surface and we are making coating on one side. If it is possible to cover something, I am skeptical about that. I need to think about it since it is in human application, not directly into the body, but it's used by human. So should be something to encapsulate the entire coating. Otherwise, simply I can say, if possible or not, I don't know, we can make 2 layers of fabric. Both the fabric have one treated surface, and those treated surface should be covered like this. Then the exposed surface is untreated. That might be one way. I need to think more on that. That's in the future perspective.
It is, the landfills are going to be the next portion of it. Is it acceptable for landfill, or is it going to be considered hazardous waste when it's at the end, right?
Yeah.
So who knows? Thanks so much.
Yeah, thank you.
One more question.
Thank you for the presentation. That was very interesting. He actually covered some of the questions I had, but I was more curious about the inhalation of silica. But you mentioned that it's supposed to be encapsulated, so that kind of explains that. Also, the skin question that he asked. But heat stress, I think it's a very important thing. People do die from that every day.
It is.
So, especially not just in America, in other countries as well, it's, not as taken care of. But yeah, thank you. That was a great presentation.
Thank you. Thank you.
So our last speaker this morning, in the morning session, discussing our PPRT, is Dr. Jonghwa Oh from the University of Alabama, Birmingham. And Birmingham. And her title of her talk is Development of a Fit Matching Tool for Safety Eyewear, Fit Examinations. So,
Hi everyone. Today I'll be presenting our research on the development of a fit matching app using 3D technology, focusing on fit examinations. So some introduction. Each day, nearly 2,000 U.S. workers sustain a work-related eye injury that requires medical treatment. And these injuries can result in time away from work, loss of productivity, and also substantial cost for workers' compensation. Although safety eyewear, which is PPE, is a last resort in the hierarchy of controls, eye protection can reduce the severity or prevent up to 90% of eye injuries if used properly. In fact, the majority of occupational eye injuries occurred when the workers were not wearing eye protection. And studies have shown that lack of fit and comfort was one of the major contributors. On the other hand, for those who are still wearing some kind of eye protection at the time of the incident, poor fitting of the safety eyewear or use of improper eye protection was the other major cause of eye injuries. However, the ANSI standard, which is the OSHA required guideline, does not provide any specific fitting guidance on fitting or sizing of eye protective devices. And as you may know, the current size offerings of safety eyewear primarily come in a universal size, and eyewear dimensions vary depending on the models, designs, and different manufacturers. And even within the same category, the sizes are different if available. All of these make the users difficult to choose properly fitting eye protection. Kind of slide is messed up. So currently, there's no tool which can objectively evaluate the degree of the fitness of protective eyewear on the wearer's face. The 3M actually developed the eyewear fit system, as you can see. Does this work? Yeah, the right. In which 12 gaps between eyewear and the wearer's face are measured to help assess the fit of safety spectacles onto the wearer's face. However, you can see on the top 6 measurement point, and then the bottom rest to 6, 7 to 12. So, however, not all of these 12 gap measurement locations will provide the same degree of protection for the users. So, our research group has been working on the development of a fit matching tool, which is app, which could objectively choose the better fitting safety eyewear based on the individual's facial dimensions using 3D technology. So the present study was proposed to obtain preliminary data to come up with a fit evaluation system. And the purpose of this study was to prioritize certain gap locations which would be more important for the safety eyewear fit than the other locations. And then for that, 3 steps were followed. And first, select a headphone model appropriate for this study. We'll talk about that shortly. And step 2, measure the 12 gaps around the eye area between the selected headphone and the safety spectacles. And lastly, examine the gap to determine certain gap locations which would be more vulnerable to passing aerosol using color hairsprays. So for the first step, 3 criteria were further set. The first, the facial dimensions of a headphone should be within the range of the 5 NIOSH headphone dimensions to potentially represent the U.S. workforce populations, their face, basically. Second, the headphone should be easily scanned with a 3D image scanner. In other words, the color of the headphone should be easily picked up by a scanner. And third, the material of the headphone should be suitable for multiple trials of color hairsprays, because the color hairsprays will be applied and then removed multiple times after each scan for the step 3. So a mannequin head, which appeared to meet the 3 criteria, was purchased and tested to confirm that all 3 criteria were met. So the second criterion was tested first. The mannequin head was scanned with a high precision scanner, as you can see on the right. And then the scanned images were meshed and imported into a CAD program. And then for the third criterion, several hairspray products with different colors and brands were examined for their removability, basically by observing any stage of color aerosol after the color hairsprays were removed on the mannequin face. And we also actually scanned the mannequin head on which the color aerosols were applied to basically to check that if the color of the hairsprays was still easily picked up by a scanner. So based on our some tests, we selected those 2 hairsprays, pink and bright orange color. So for the first criterion, 2 anthropometric measurements of the scanned mannequin head were measured in the CAD software using the measurement tool in the software. And then those dimensions were compared with the NIOSH headphone dimensions. As you can see, the bottom here on the right, those are digital files from the NIOSH headphones, basically. So those the 2 anthropometric measurements were by zygomatic breadth, which is you can see on the left here, A, which is the maximum horizontal breadth between the zygomatic arches of the face, and the interpupillary breadth, which is shown in B, figure B, which is the horizontal distance between the center of the left pupil and the right pupil. For this, we had to assume that the center of the eye of the mannequin head was the center of the pupil, because if you remember this mannequin, they didn't have pupils, basically. So And those are actually, those two dimensions actually were selected based on the importance in eye and face protection devices, as well as, easy kind of identification of facial landmarks using scanner. So for step 2, gap measurements, 14 full-frame safety spectacles were purchased from various manufacturers. And Allen Wrench set is seen on the right, having tip diameters of 1.5 to 10 millimeters were used. And starting with the largest size, which was 10 millimeters, if the wrench tip was able to pass between the mannequin face and the safety eyewear, then the gap was checked as over 10 millimeters. And then if it's not, then the gap checking was continued on using gradually smaller wrench sizes until it fit tightly. So for step 3, first of all, we determined the ideal coverage area, which is expected to be completely protected from wearing a safety spectacle by drawing along the frontal, up there, frontal bone, zygomatic bone, and the maxilla here. And you can see those circles around the eye area. So, and those areas were calculated using area calculation software. And they were approximately 26 to 27 square centimeters per each. And then for aerosol test, the orange spray you can see on the bottom here. So was horizontally applied in a left to right motion for 5 seconds, and then another, the spray was repeated from the other way, right to left motion for 5 seconds. And then for pink spray, the spray was applied at each 3, you can see here, each 3 different points, 49 degrees, 90 degrees, and 135 degrees from the top for 2 seconds per each on the right and left side of the mannequin head. And then the mannequin head was scanned to capture the 3D images of the sprayed headphone. Then area where the color aerosol passed into the ideal coverage area was calculated using the same the software. And then after that, we determined the aerosol pass rate by dividing the area where aerosol passed into the ideal coverage area by ideal coverage area. So results. This table shows the anthropometric measurements of the mannequin head. You can see the top line for the mannequin head, and then you see also the NIOSH headphone dimensions here too. So if you can see there, the mannequin head was the closest to the NIOSH, small here to here. Headphone size in bizygomatic breath, and then the large headphone size in interpupillary breath. And then step 2 results. These tables from here to 2 of these show the gap sizes per each eyewear at each of the 12 gap measurement locations. And the gap size ranged from 1.5 to over 10 millimeters. And then if you split it into upper and bottom part of the measurements. Then upper measurement points ranged from 1.5 to 10 millimeters, and then lower measurement points ranged from 4 millimeters with a few gaps over 10 millimeters. So you can see the pattern that, usually the lower measurement points, they had larger gaps than upper measurement points. And then the following 3 tables show the fit and gap measurements. Those are showing the area where color errors are passed into ideal coverage area, and here on the here, and then the corresponding error surpass rate. Error surpass rate. So the area where the color errors are passed into the ideal coverage area was from about 16 to 47 cubic centimeters, square centimeters, and then the corresponding error surpass rate was approximately 29 to 88%. So it's hard to read. You have a lot going on. So here, the top spectacles, which had the lowest upper gap measurements, as well as top 5 spectacles, which had the lowest bottom gap measurements, are listed here. So you see the pattern in general, safety spectacles had larger gap sizes at the lower measurement points. Yes. Okay. And then here, you see the top 5 spectacles that had the smallest gaps overall are listed here, as well as the top 5 spectacles that had the smallest error surpass rate. And so based on the data, you can see the overall gap size, actually, they are matching pretty good, but the order of the overall smallest gap size was not necessarily matched with the order of the smallest error surpass rate. And so if you look at the data more in detail, that even though the safety spectacles had a larger gap size at the bottom, the lower measurement points tended to have tends to better predict actually the error surpass rate. So some limitations. Even though the mannequin head dimensions were within the 9-inch headphone sizes, it does not necessarily mean that this is representing U.S. workforce population the facial dimensions. And also, we didn't examine all possible angles at eyewear where small debris can possibly pass to the eye area. And there could be some variations in the amount of aerosol applied. There was human error, as you can imagine. And then also, the color of aerosol was not really location specific, which did not allow us to analyze the error surpass rate at each specific gap measurement location. So to conclude this study, the gap let's jump into the conclusion there. So the order of the overall smallest gap size was not matched with the order of the smallest error surpass rate results. The lower gap measurement points appear to better predict the error surpass rate. So our further studies should be followed with multiple aerosol colors to help determine prioritized location-specific measurements points, along with the better controlled application of color aerosol, like using a robotic hand or something like that. So we submitted R03, 9-inch R03 grant. So based on the findings in this study, we proposed a fit evaluation system, which basically weighs more for the bottom of the measurement points, and to basically determine overall fit, best fitting eyewear. So I'm thankful for being awarded for this grant from Deep South Center. And our students, Erin, she graduated now. And then Nathan, he helped with our doctoral student. He helped her throughout the project. And also our collaborators and Dr. Claudio Longo and Forrest, he's actually our software engineer. He's developing now of matching it with us.
Go to this mic. Wow, I love the name Hellraiser. I have to give me a pair of those glasses, although they didn't test very well, right? The Hellraiser. But is there any fit testing requirements, like annual for glasses or anything? Because I wondered about that, if something like that eventually come with how quickly people's faces change, especially Americans like me that like to eat a lot of Cheez-Its. So thank you.
So we are basically developing an app which you can just download on your phone, smartphones, and if you scan your face with that phone, and then it's gonna, based on database that has, we are having a lot of safety eyewear dimensions in our the software, so that software can find you a better fitting eyewear based on your facial dimensions and the eyewear dimensions. That's what we are trying to do now.